In this age of social media, there's a lot of pressure, more than ever really, to look good because it's easier than ever for people to bully or criticize you over your appearance online.
Instagram and Facebook recently announced the decision to block certain posts, and some celebrities like James Corden have come out against fat shaming. The reality is, though, it is not always as simple as diet and exercise for people with certain medical conditions.
And in some cases, being overweight doesn't necessarily mean a person is completely unhealthy. So let's get to the facts here. Morning anchor and health reporter Kirstin O'Connor is standing by now to ask a doctor.
So this is a sensitive one. We want to talk with the doctor about being overweight and what's actually healthy. So Dr. Harold Nera from Oviedo Medical Center is here with us. We appreciate your time. We thank you so much.
Thank you for letting me come to talk such a misunderstood and I think undertreated disease that we have in this country.
And we were talking about it a little bit beforehand. What are some of the underlying things that could be causing obesity that people, can't really see from the outside?
Yeah, I mean, obesity is such a complex disease, and that's why I think people need to understand that it's not as easy as just telling everybody, if you eat less and exercise more, you're gonna lose weight. Unfortunately, that works for a lot of us. And exercise and dieting and eating a healthy diet is important for all of us, but it doesn't work for a lot of people. So there's a lot of influence that actually help us maintain that weight in our body, and it's related to genes and to your environment and to the way you process foods, and that's all run by genetic. And those we have now finally starting to concentrate on treating that obesity and identifying those genes and identifying the main causes of obesity. Until now, I think we have done a very, very poor job. We've spent billions of dollars trying to treat all the symptoms of obesity, but we haven't really treated the obesity epidemic that we have. And that's, I think, the most important thing is to see a doctor, talk about your BMI, talk about where you are in your BMI, which is a body mass index, which is what we use in order to calculate where you are in the obesity scale. And once you know your BMI and you can figure out what's your goal, then your goal should be anything below a 30. A BMI below 30 is where you really have very low risk of developing all those complications from obesity. So.
And you mentioned BMI. That's another topic we wanted to talk about. How does BMI reflect your health? Are there some patients who come in and have a BMI that's not ideal, but actually have very healthy lifestyles and are working with a healthy diet?
They do, actually. Yeah, they're dieting, they're eating the right things, and they still are unable to lose their weight significantly. And that's where I'm involved. I'm a surgeon, so I do weight loss surgery. And that's, we work them up with their medical doctor, try to figure out exactly what's the problem. And if they have tried all the dieting and have tried exercise programs and they're still unable to reach the BMI goal, then surgery is really the only treatment for obesity. And the reason I say that is because obesity is it's a disease. And that's what I want people to understand is that we got to take that shame away from blaming the patients and saying, exercise more, eat less. Some people just can't, and we have to really understand that as physicians that we need to treat them with the right treatment, which in my case is the surgery. We go through a very long process of trying to identify those patients that would be a good candidate for surgery. And once we identify them, then by doing the surgical procedure, we're actually chemically changing the patient. And that's the important thing is that for this patient to be able to lose their weight, they have to be chemically changed. It's a disease that we have to be treated that way, and they have to be chemically changed in order for them to be able to achieve a healthier BMI.
What are some of the medical conditions that you see with patients who have obesity that they're struggling with that they really cannot control?
Yeah, it's amazing. The list just goes on and on. I mean, it goes all the way from the most common one, which is diabetes, high blood pressure, high cholesterol, to thyroid problems in females. It goes even to PCOS, which is polycystic ovarian syndrome, where people, young females aren't able to be pregnant because they have such issues with their hormone levels, and that's all affected by weight and the way their bodies are processing those hormones. So after surgery, all those things are affected. and they see all the benefits of weight loss, and they see that their blood pressure almost, in some cases, overnight, their blood pressure and their diabetes is resolved. It's that powerful of a treatment.
Incredible, yeah. And I know that the ladies were introing and talking about social media and how there's a lot of pressures nowadays for people to go on these certain diets and make lifestyle changes that they can look just like somebody who they're
Correct.
following on social media.
Yeah.
Why is that just not true for a lot of people?
Well, it's their body has something called what we believe now is a set point. It's all like a thermostat for your body, and your body is going to want to stay in that level, as much as possible. And unless you really do a lot of effort, and diet and exercise, all it does is kind of brings it up and down a little bit, that set point. But your body wants to push you. Every time you diet, you lose a little bit of weight, but then your hunger hormone goes up and your metabolism slows down because your body's trying to push you back to that set point. So it's really hard for someone to just dieting and they don't see results after 6 months. Most of us will give up on any diet, and then you'll go back to that weight or even more because your body is now trying to save some of that energy in order to not go back and lose that weight and stay in that set point. So it's very difficult for some people and frustrating for physicians, for primary care doctors and surgeons like myself to be able to treat him properly until we really understand what obesity is like. I think they've identified over 140 genes that regulate that set point. And each one of those genes create different chemicals, and different organs are involved in this management of this weight, of this set point. So it's really complex, and we are just now starting to really understand. Our hope in the Society of the Bariatric Surgery, our hope is to really in the future, genetically test all of our patients and see which patients are being affected by intake of carbohydrates, or if they're addicted to sugars, or if they're really gonna, or they're gonna be better with a medication or better with a surgical approach. So that's the future of obesity treatment, I think, and that's coming soon, hopefully. There's a lot of much brighter people than myself doing a lot of research in obesity at this point.
That's right. We just talked about genetic testing last week. So
That's
it's
right.
great to talk with you. Thank you so much for coming in and answering a lot of our questions. We will make sure to come and bring you back.
The most important thing is see your primary care doctor and make sure that you know what your BMI is and what your goals are.
All right. We appreciate
Thank you.
it. I'll send it back to the ladies at the desk now.
All right, Kirstin, thank you.